Well, well, well. Welcome to the Nurse Mark and the Green Nurse podcast,
where we bring hope and inspiration for growth and healing. And we're here to change the dialogue and stigma around what it means to feel good or hence be high. H for hope, I for inspiration, G for growth, and H for healing.
You know, Sherri, we often talk about things that people don't want to talk about, things that have stigma, but they're important subjects and we really need to talk about them to remove the stigma so people can be healed.
Yes, we do, Nurse Mark. And 2021 is the year of the nurse and the midwife. And we've been highlighting and illuminating health professionals and cannabis nurses across the globe. So we had a very special guest on for tonight, Captain Straw. He's a retired Air Force captain and war veteran, and he had to cancel with us tonight. He's going to be coming on in June, and we want to give him a big, huge shout out and his wife, Sherri. And we hope you both feel better.
Yes. So, of course, Sherri put together this awesome idea, and here we are. This is going to be a fun show. Really, Sherri, I'm so excited for this one. So, you know, May is Mental Health Awareness Month, and it's been observed since 1949. And the purpose is to raise awareness and educate the public about mental illness and to reduce the stigma, the negative attitudes and misconceptions that surround mental illness. And oh my gosh, you know, since 1949 and we still have stigma. Yeah, we got to talk about it. So, Sherri, what's the theme for 2021?
Here it is. The theme is you are not alone, right? The focus is on healing and the healing value of connecting in real safe ways. This really ties into tonight's top topic, so I'm really excited. So connection. So how do we prioritize mental health or mental wellness? And also acknowledging that it's okay to not be okay. And then also providing awareness on mental health awareness tools. And so currently, Mark, you and I both know we're fighting the SAAD epidemic.
Right.
Suicide, addiction, anxiety, and depression. Right.
We are.
And there's some pretty significant numbers. You know, 2020 has been the pandemic has created so much trauma for so many different people. And the interesting statistics from the Center of Disease Control is 1 in 4 young adults have contemplated suicide during the pandemic.
Imagine that. 25% of young adults.
That's a lot.
It's awful.
20 million plus Americans struggle with addiction.
Right.
That's a lot.
That's a lot.
Here's the next staggering number. 41% of the United States adults have experienced anxiety or depression during the pandemic. It's almost half of the population.
And of course, Sherri, I mean, none of us have lived through a pandemic before. Like this is the only one we've had in our generation. In it's not uncommon in the history of the world, by the way, but for us in our generation, we've never experienced anything like this. And of course, it's going to be anxiety provoking and just the state of the world prior to that was a little bit anxiety provoking.
Exactly.
And then we got a pandemic. Oh,
and then it's like people don't, here it is emotional regulation. How are you able to get through these situations? And, people, everyone's world's being turned upside down all at the same time.
Right.
And then, do you have the proper tools to be able to handle that stress? It's not just stress in one area of our lives.
Yeah. Even prior to the pandemic, the World Health Organization estimated that by 2030, depression alone is going to be the greatest healthcare burden that the world faces. That's a staggering number of people. Yeah. So, we need something now, don't we?
We do need something now. And traditionally, what do they use? They use pharmaceuticals, a hodgepodge of pharmaceuticals.
We do the best we can.
The best we can.
I think if you ask any psychiatrist or anybody who's prescribing, they'll tell you that it's probably less than half the time that they're effective and they take so long to work. If you're prescribed an SSRI, it's weeks before you find out if it works. And when you're in crisis, you don't have weeks to wait.
You don't have weeks. No, you don't.
So
it leads into tonight's topic. And tonight we're going to be talking about a very, very powerful treatment that both Mark and I have experienced as patients and the company that we are now working for.
Yeah.
We're going to just start off by congratulating Nurse Mark. I want to introduce the COO of KetaMD, Nurse Mark Worcester.
Well, thank you, Sherri. Excited to be in the position.
It is. It's so, and I'm really, really excited to be on this parallel path with you and how we're changing the world one dendrite at a time.
Yeah.
So really, I am humbly honored, blessed, and grateful to be the third KetaMD nurse guide in the country, working with the most amazing conscious healers and health professionals that I've ever met.
Mm-hmm.
So now, we're going to be talking about this treatment, and we're going to share why we're so excited about ketamine treatment. And Mark, you brought me into this awesome game, you and Nurse Jamie.
Yeah, and she has done just an amazing job building out the first real ketamine nurse guide certification program.
Yeah.
Amazing.
Built it from
the ground up. Yeah.
Yep. Jamie Rollins created it. I went through the training process and became one of her third nurse guides. And so I'm really, really honored.
So let's rip into it, Sherri. There's so much talk about psychedelics and ketamine and where these things fall on the scale. And so ketamine's been around for an awfully long time. It was developed by a gentleman a chemist by the name of Calvin Stevens in 1962. And studies were done shortly thereafter for its anesthetic qualities. And so it's a powerful anesthetic and a rapid pain reliever. But the good news is that it's a very safe anesthetic because it doesn't affect your respiratory and heart rate. So, it's used quite frequently in surgery with infants. So we know that it has to be very safe in order to really do that. So here we are. We have this great anesthetic that's used all the time. If you're an anesthesiologist, ketamine inside and out because you're using it frequently, right?
Oh, yeah.
So here's the really important note. In the last 2 decades, there have been studies that have been done that have shown that ketamine has an amazing property of relieving depression. So for people, I'm one of them, who have treatment-resistant depression. It is a thing. So, medications, traditional pharmaceutical medications just don't do the job. This is an amazing opportunity using ketamine.
Yep.
Yeah.
And so hundreds of clinics around the world have been administering ketamine, and now it can be done at home. So ketamine is an FDA approved as an anesthetic, and it is being used off-label to treat pain, depression, and a variety of other conditions.
And medications are used off-label quite often, and that refers to they're put through the FDA authorization process. Medications, right? Pharmaceutical companies put them through the process, which is very expensive because you have to do a lot of clinical trials, and they're very expensive to do. So they go through this process, and then they're authorized for a specific use.
Exactly.
And what happens over time is that a physician may prescribe it and notices that there's this positive side effect. Like somebody noticed, well, this person is depressed now, right? So all of a sudden you start to use these medications off label. So all it means is the primary indication is this.
Exactly.
But we've now noticed that it does this. So it's fully legal and you're able to do this off label.
Let's give a classic example. Neurontin, right? What is Neurontin traditionally used for?
Oh my gosh. Yeah.
It's used for as a seizure medication.
Yeah.
Right. And so they use it off label for neuropathy.
Yeah. Neuropathic pain, because neuropathic pain is not treated well with any other, other than cannabis, which we know we love that.
Nurse Mark, and here's the other thing. These are the other things you're using it for off label. I was floored because my doctor had actually recommended them. Okay, you ready? For sleep.
Yeah.
For daytime anxiety, if you take it the night before.
Yep.
And then now I heard, because I'm starting to have hot flashes, my doctor was like, take the gabapentin that I already prescribed.
Listen, it's a drug that's prescribed a lot to people and animals. I got a cat that's on gabapentin right now.
Right. So anyway, so
very
the
happy, well-adjusted cat, by the way.
Exactly, gabapentin for the cat. So
anyway, getting back to ketamine,
the bottom line is that there's a lot of medications that are originally been manufactured for one purpose, and then over time they've noticed that they have beneficial effects for other purpose, and that's called the off-label use.
Right.
So ketamine has been used to treat depression, treatment-resistant depression, postpartum depression, acute PTSD, complex PTSD, comorbid PTSD, alcohol addiction, drug addiction, anxiety, mood disorders, bipolar mood disorder, obsessive compulsive disorder, neuropathic pain, migraine headaches, fibromyalgia, and burnout, just to give a few examples.
Yeah. Now, you notice we don't say that it cures these things.
No.
Right? It's an effective treatment. Right. And so it's an amazing thing. So
it is.
Here we go.
Yeah.
How does ketamine work, Sherri?
How does it work? So we tackle stress, anxiety, depression, mood disorders. And so it does it in a really amazing way. So it works as, remember we were talking before on the show about agonist and antagonist, right? So it works as an antagonist in these areas of our brain. And what it essentially does is it resets and refreshes the nerves in the brain that support the new growth of neural pathways, which actually optimize healthy brain function.
Yeah,
right?
So it is an agonist at the NMDA receptor, right? An antagonist, sorry. And so, so it's going to block that glutamate. Glutamate is one of the major neurotransmitters, and so it calms the brain's main excitatory neurotransmitter, right? You have some neurotransmitters that excite and some that inhibit, right? So action potential, all this stuff. So glutamate, ketamine enhances mental clarity and reduces mental chatter, makes it easier to deal with life's challenges and cope with mental health issues.
Right.
Now, again, these are this is the world of this is the new world of mental health care.
Yeah, it is. It's patient empowerment, right? So can you imagine being on pharmaceuticals for years and years and years and years and years and not working and switching and combining and doing X, Y, and
Sherri, I can imagine that. I've got 25 years of experience in that.
And then to find something that you could either do 1 or 6 treatments.
Right.
And to be completely 100% reset. So this is what it does. So ketamine taps into that default mode network, right? Part of the brain, which becomes active when we're thinking, daydreaming, reflecting on the past, or even thinking about the future. So when this area of our brain is overactive, it can be associated with stress, negative thought patterns. And this can make it really hard for people to cope with unexpected challenges, tragedies, difficult life events, pandemic, right? That's what I think, pandemic.
Yeah.
So it works on that area of the brain. It works in the default mode network called, ready? Lateral habenula.
And that is a very old part of the brain. You know how our brain has evolved over time under, many, 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 many eons, so that's a very old part of the brain. It was very valuable way back when we were being chased by tigers.
Exactly.
It was a very valuable part.
So what happens, what happens?
Gummed up.
It gets bombarded, right? So what happens?
Sherri, you got to keep going. I got a chicken in the oven. I got to shut it off.
Oh, he's got a chicken in the oven.
I got a roast chicken in the oven. So hold on.
Okay.
Hold on. Go ahead. Keep going.
I'll talk a little bit about the lateral habenula. So, seriously, it works in this area of your brain that's associated with negative emotions or stress. So if you think about it, when we become overloaded, multiple different areas, mind, body, spirit, physical, mental, emotional, spiritual, all of these different things coming at us at once can get overloaded. And then what happens is this area of our brain, the lateral habenula, goes into burst mode. And what that actually does is it triggers despair, right? And people can have a lack of pleasure. You get into that state where nothing is pleasurable anymore, right? So ketamine, what it does is it quickly elevates our mood by blocking that burst activity. That to me is really, really fascinating. So according to the molecular psychiatry, ketamine has also been shown to reverse dendrite atrophy caused by unpredictable stress exposure. So literally, in other words, what they're trying to say here is ketamine refreshes the brain. Okay. Mark and I are going to talk about our experiences in a minute. But in the hours following, what was that?
We're going to talk about a fine roast chicken.
Yes.
Okay.
I just went over and save me a piece of that chicken. I'll have a wing.
Oh my gosh. Fresh from the farm chicken. Ooh,
fresh farm chicken. There you go. You're going to be eating with us?
Woo-hoo. All right. Where are we at? You talked about the lateral habenula?
Yeah, and the lateral habenula, how it becomes overloaded and it goes into burst mode. It's like firing, right? The triggering of the despair, and we have that sense, that lack of pleasure in our lives. So it elevates our mood by blocking that burst activity. And like I said, it literally refreshes our brain, right? And that's when we get into the
stress. I mean, stress does cause your brain to, lose neurons, lose dendrites. That's noted. We know that.
Right.
So for this to actually promote it, amazing.
Right.
Yeah.
Love this next part too. So some of the things that we say as a nurse guide is the magic isn't even in this session, even in this treatment session. The magic happens afterwards, following the treatment, because the ketamine, as it starts to metabolize, triggers both, you ready? Synaptogenesis and neurogenesis. So neurogenesis is the process by which new neurons are formed in the brain. And synaptogenesis is the formation of synapses between the neurons in the nervous system. So cool.
It is. Yeah, so that's in contrast with many of the conventional antidepressants and anti-anxiety medications, whose effects last only with the presence of the medication in your body. Ketamine really makes the changes in the connections in your brain, and it gives you the opportunity to develop new positive thought patterns and behaviors. So the healing benefits last well beyond the initial treatment. And that's why it's been so shown to be so effective in patients with treatment-resistant depression and trauma.
Right. And here's the other thing that I really like too, even though when we go, mental, emotional, how about physical? So it also blocks pain receptors and reduces inflammation, assisting in its effectiveness in treating many other types of mood disorders, depression, anxiety, PTSD, sleep problems, and pain.
Yeah, of course. I mean, when you're depressed, your sensitivity to pain is increased, right? So, this double up here where it also is effective against pain.
I know, like you've even we'll describe our experiences in a minute, but yeah, we've experienced a melting away.
Yeah, Melissa's got a question. Any effect on myelin? I do not think so. I don't think that it affects myelin. I haven't read any studies that have shown that it does. That's a very specific item in the nerve.
The myelin protects the nerve.
It's like the sheath around the nerve. Yeah.
Like the cover.
Yeah.
Right. It's like this, you have a straw. It's like the paper. That's the myelin is the paper around the straw. Yeah. So it hasn't.
So how effective is ketamine treatment for depression, Sherri?
Well, I am really excited. In clinical trials since year 2000, ketamine has shown improvement in 70 to 80% of patients who are treated for depression. That's significant.
Yeah. Yeah. And the American Psychiatric Association reports compelling evidence that the antidepressant effects of ketamine, and this is for infusion, are both rapid and robust.
Right. And so for the last 2 decades, researchers at Yale have led ketamine research for patients with severe depression who have not improved with standard antidepressants or treatments. More than half of the participants showed a significant decrease in depression symptoms after just 24 hours. And these are those patients who felt no meaningful improvement on any other treatment or antidepressant medications.
Right. There are people who suffer, for decades trying everything that they can. And even going so far as to have ECT and TMS and other, electrical stimulation, just to try to step out of this depressive state.
Yeah. Right. So Mark, is it a hallucinogenic?
Well, no, it's sub-anesthetic doses. Ketamine is not considered a hallucinogenic. It's more accurately defined as a dissociative. So ketamine is also sometimes considered a psychedelic, a substance capable of producing profound experiences of reality. So a very high anesthetic dose puts you to sleep, and that dissociation means your mind, your consciousness is separated from your body, so you're not feeling pain. But at low sub-anesthetic doses, you enter a dreamlike state characterized by colorful visuals, feeling of euphoria, and the ability to mentally examine any troubling subjects in your life from a new and expanded perspective.
Exactly. Yeah. Exactly.
Yeah.
So
what does it feel like?
What's it feel like? All right. Well, I'm going to just, for me, it was very, very peaceful. Many people, we say this, many people describe it as the most peaceful experience they've ever had in their life. I would say it was definitely a sinking in, going really deep in, kind of melting away. It reminded me of, definitely separating, having consciousness without a body. That's a good way. In a very gentle way, and having those beautiful visuals and being guided by music, and the change in the music and the tones and the vibration would just bring on other waves of feeling, waves of emotion, different visuals, but in a really, really calm twilight kind of a way. If you ever know what twilight sleep is, this is what I'll explain. Twilight sleep is basically that type of sleep if I'm feeling elevated from cannabis and I can't sleep and I'm laying there and I'm vibrating, right? And I put the headset on and listen to music. So it's twilight, like you're not completely awake, you're not completely asleep, but just in this moment, this present moment with a clear mind and deep relaxation. So yeah, I was awake, I was fully aware in the experience, but in my own little bubble world. After the experience, I felt like I was floaty, a little bit out of it, but it went away very fast. And I woke up feeling very calm, present, grounded, and mindful.
Yeah. People really say it's probably the most relaxed that they've ever felt.
Yeah.
Yeah.
How about you, Nurse Mark? How about your experiences?
Well, mine were the same, and I'll tell you, so I cover this in my book, Absolutely Fucking Amazing, Living a Life You Love. I had to put together a regimen. Oh, there it is. I had to put together a regimen on my own after 25 years of being treated. No medications worked. I did a lot of other work like meditation and yoga and exercise were always a part of this. And I finally get to a point where I was able to put together this routine that if I stuck to it, my depression was relieved to a major extent. But with the pandemic, Sherri, I lost the ability to go to the gym and exercise, right? And it was hard because, the particular exercise routine I use, it really isn't good to be at the gym. Anyways, I fell out of that routine. And so what do you think happened? When that portion, that important part of my routine that keeps my depression at bay was removed, depression came back. Yeah. And so at just the right moment, I was able to have a ketamine treatment and it literally lifted that depression at that moment. It was gone.
Yeah. And in same, very similar circumstance too, with my own experiences as going through some life challenges, right? The life challenges didn't affect me as negatively as they might have if I hadn't, because I was I was able to process those challenges from a different perspective.
Yeah.
Right.
Yeah.
Really, really cool.
Oh, yeah. So, Sher, this is a question that comes up a lot now when people are talking about ketamine. It's like, is this the same club drug known as Special K?
No, it's not.
No.
So Special K is a powder form of ketamine that's snorted nasally in high doses.
Right.
It's a drug that's coming from an unregulated source. It's unclear. often be mixed with psychoactive or harmful substances.
And when you snort it, it's accessing opioid receptors,
right,
rather than taking it, by mouth or by injection or infusion.
right,
It's hitting those opioid receptors, right away. And
right.
so yeah, that for Special K, it's different.
It's different. And the thing too is the thing with Special K, like Mark just said, when you snort it and it's activating those opioid receptors in the specific area of your brain, what that can actually do is trigger addictive responses or abuse.
Yep.
So basically, to receive the medicinal benefit of ketamine, it must be administered by a clinician in a safe, thoughtful way.
Right. Exactly. Route of administration makes a difference. It really does.
It does. What about this one? What about this one I've heard?
Yeah.
Well, isn't ketamine a horse tranquilizer? Why would I want to use that?
Well, yeah, because horses are very expensive. And they're not going to use an anesthetic that could possibly cause harm. They're going to use something super safe. And yeah, okay, it's been used in veterinarian medicine, but it's also been used in human medicine. Yeah, it's been an anesthetic in both areas because it's well tolerated and safe for use. Yeah.
Right. Yeah, I think it's a fun one, And so, it's interesting. So it's definitely one of the most common anesthetics around the world, and having that dissociative property at low doses, it does have profound effects on the brain. I've noticed it. It makes an excellent treatment for depression, anxiety, PTSD, and addiction.
Yeah.
Right.
Yeah. I mean, and it does have to do with the amount that you're using as well. Like in anesthesia for surgery, they're using a very high dose to produce that dissociative effect. And for the treatment in depression, not so much. No. So, is ketamine addictive?
Well, from what I have read in studies, no addiction issues have arisen in the many studies by investigating ketamine for depression, right? So for depression. And so no issues have arisen in the many decades that ketamine has been used for anesthesia. So the question often stems from the past, that the special that we were talking about, and how people use it recreationally, unsupervised, high doses, frequent dosing, self-administered, unmonitored. And so we talked about that. So when it's administered nasally and it hits those endogenous opioid receptors with more potency
at high doses. Doses.
Using ketamine medicinally, it's the same. It's
it's like bath salts, Sherri. You can put them in your bath and have a wonderful experience, but if you snort them, it's not going to go so well for you, right? Yeah. Right. Melissa, thanks for being open and honest. Welcome aboard. Yeah.
Welcome aboard.
Yep.
Yeah.
Yep.
I'm just going to say, I could tell you what it really helped me with. It helped me with my agoraphobia. So that's one of the.
Like that's a thing for you. That's a thing
really,
that you struggle with.
And so for me to feel really comfortable doing things that I haven't feel comfortable doing, like just going to the grocery store, like I'm going to go to the grocery store and not have to plan it out, think it out, map it out. Seriously, like that takes so much energy. And so it rewired my brain in such a way that going to the grocery store is just like going to get gas or going to the post office. It's just something that you do instead of it being this big, huge trauma in my mind, this trauma in my drama. It went away, So now I get excited. I take selfies of myself in the Stop and Shop parking lot. I'm like, woohoo, look at me.
Yeah, I'm outside. No, it's a serious thing. For somebody who has agoraphobia, it's
a big deal.
It can be debilitating. It really can.
It's embarrassing, but I can laugh now.
Well, of course you can. That's what we're here for, right? We talk about stuff that has stigma attached. Nobody wants to say, oh, I have agoraphobia. I really can't go meet you for drinks, right? It's just like, well, it's just like, it's a serious deal.
It's really weird to be invited to do something so exciting and then to be like, whoa.
Yeah.
Like, let's go to Lady Gaga concert. Someone says to me, I'm like, whoa, I don't know if I can.
Oh, big crowds, big crowds. That's really panicky.
But interesting enough is I'm excited. I'm going to plan that. I'm manifesting that Lady Gaga concert for sure.
Yeah, baby. That's a good one to go to.
That's a good one to go to.
So what is KetaMD? Really, we're a platform that connects doctors and nurse guides with clients who are looking to see if this will work for them. So it's up to the physician to decide if on your initial consult, it's up to the physician to decide if it's right for you. You and the physician will work together to decide this.
Yep. So, well, Mark, is there anyone that shouldn't get ketamine treatment?
Well, there are definitely some things that you have to take note of, like people who have uncontrolled hypertension, right? So if you're not treating your hypertension and you have that, that's one of the indications you probably should not use ketamine, have a ketamine treatment. And also if you're prone to psychoses, obviously anything that's going to stimulate the brain, if you have a proclivity for that experience, you don't want to push it in that direction, right? So
and then women who are pregnant or breastfeeding or women who may be pregnant should not also receive ketamine.
Of course, treatment. And that's just anytime you're pregnant, you don't want to be taking much of anything because we just don't know what effect. Yeah. So Melissa and Amy, thanks for kicking in here, but because it's an off-label use of ketamine, it is not covered by insurance yet. There is a ketamine task force that is working very hard to change that. And, at some point in the future, I'm certain that it will be covered by insurance, but right now it's private pay.
It's private pay. Yeah. So there's something that's really exciting that's coming out, right? I just did a post on it. There's a documentary, Lamar Odom Reborn.
Yeah, tomorrow it's kicking off. So go to LamarOdomReborn.com and it's a documentary. It's the story of Lamar Odom, who you may know is a two-time world champion basketball player, was married to Khloe Kardashian, I believe. So he had a really terrible addiction problem, and he almost died. I think he had 12 strokes and 6 heart attacks, and was just, his family were told to say goodbye to him. And it's the story how the co-founders of KetaMD worked with Lamar and helped him with some ketamine treatments to alleviate that issue and have a profound effect for him. So it's a great story, and it's perfect to launch on Mental Health Awareness Day, right? It's so perfect. And so again, go to LamarOdomReborn.com.
And I have that if you look in the notes that I put together, it should be right in there. I put a link right in there. Right.
You did put the link in? Yeah. I think it's through MTV. And so it's a new link. So let's make sure we get the right one.
And so the affirmation is, may the launch of this film signify the beginning of a massive shift from the current medical model in mental health care to a more effective model. Mental wellness, right? Mental wellness.
Yeah. So it is a new model. It's a new opportunity. It's a new world in mental health care. And it's so exciting to be a part of it. So, all I can say is stay tuned. This is a brave new world. And so Sherri, wrap it up.
I'll wrap it up.
Wrap it up.
I'm going to wrap it up. So many of us cannabis nurses at the Green Nurse are also stepping into the role of becoming ketamine nurse guides for mental wellness and the health of our endocannabinoid systems. So we really want to see everyone in the thrive zone, the daily 5 to thrive. Hey, Nurse Carrie Lee. And not merely surviving, right? So that's her thing. Daily 5 to thrive, We want you all to be in the thrive zone, not just merely surviving. We all deserve to feel good. And it is really about living your best life, helping others to do the same.
Right.
So just like Mark and I have come out of the closet with our cannabis stories and we're educating you on cannabis, we're going to be opening up more about ketamine and other psychedelics and how they've played a pivotal role in our lives and a lot of the lives of the patients and clients that we work with, and how it's helped us process these mental health challenges such as PTSD, panic disorder.
Listen, we're human. We get wired in ways. It's just how it happens. Either genetic predisposition and an experience and trauma and all this stuff. We get wired for these things. And so how do you deal with it?
Let's rewire. We're gonna grow new dendrites. Increase neuroplasticity, the way
we're gonna shift it. Now, I like what Gene Roma shared here. It said he has used the so Gene, you've used the memory of the experience to try to duplicate it naturally in meditation, and you've been able to do that. Yeah, there's new things coming out that once you've had that experience, you could actually utilize like virtual reality and like have the experience of the visual and cue your brain to enter that space again. I mean, it's a brave new world.
It is a brave, Mark, and I'm going to say that a lot of the times too, when I can't sleep at night, it's the same thing. I'll put on the headset, I'll put on the meditation. Now, and it takes me right back to
that spot, right? Well, think about it. And we're going to wrap up with this. Think about this. You know, music is something very special because when you hear a song from your past, don't you immediately remember who you were with or a relationship you were in or where you were? Like music is embedded in here, right? And it ties to those memory circuits. So when you hear that same music that you listen to, very intentional, you know, frequency-based healing music while you're doing your session, you know, it will bring you right back there again.
It will.
Right back. It's amazing. Oh, it's great to be human. It's great to have these brains in here.
I'm grateful that I can finally use it again. I can use it.
Yeah.
Right? For a long time, it was
Gerald popped up and said drugs and alcohol are byproduct of trauma. Yeah, man. Can be many times. Yeah. Yep.
Absolutely. Right.
So, hey, thanks everybody for being here tonight, sharing this moment with us.
We're here. We are dedicated and committed to helping decrease stigma around using other types of progressive tools for healing. You know, so stay tuned for more podcasts. We're just getting started.
Just getting started, folks.
Mark, COO of KetaMD.
Thank you, Sherri.
There's a lot of nurses coming. Nurse guide. Yes, it's wonderful. It is such an honor to be able to hold space when someone is in their most vulnerable moment, opening up their minds, their hearts, and their souls to have a new experience. Wow. Right?
Yeah.
Truly blessed.
You know, we're blessed, and we're blessed to have you here listening with us tonight. Thank you so much for chiming in and being open and honest and in the dialogue. You make this all happen. You really do. We're here just spreading some information, and you're making this whole community work. So thank you so much. Sherri, partner, you know, I ask you every morning, what's it all about?
Y'all know what it's all about. It is about living your best life, helping others do the same, and decreasing stigma around what it means to feel good. Yes. Good night, everybody.
Good night, everybody.